Hello, Dr. Darrell.
Good evening, Aubrey.
Good evening and good afternoon, good morning, good evening to all our listeners and viewers from across the globe. We have with us, friends, Dr. Darrell. He is a COVID expert. He has treated over 10,000 patients with acute COVID disease since May 2020. He has experienced 66 admissions and 21 deaths among his patients. Today, we are here to primarily have a Q&A session with our COVID guru, Dr. Darrell DeMello, and the subject and topic is COVID-19 OMICRON variant. Dr. Darrell, given your experience with treating COVID using early treatment protocol developed by you, can you tell us something about the new variant OMICRON?
Yes, Aubrey, thank you for the question. OMICRON or Omicron is a variant now that was discovered or detected in South Africa and countries surrounding South Africa, Botswana and a few other countries. Only last week it was made public. I'm told we were detected sometime in early November, and there have been like 20 or 30 cases so far. I'm guessing they are all increasing pretty rapidly. But those cases are presenting with very mild symptoms of sore muscles, body pain, an occasional cough. No major issues with them, and it's something that is pretty surprising given the fact that COVID is. To me, it's not surprising, and I'll discuss it later in the discussion. This is coming out of South Africa, so many of us around the world who treat COVID are watching the developers in South Africa, Botswana, and other countries very closely to see how it can occur and how it can hamper our COVID progression in India and in other countries in the world.
Right. Okay. So can you explain what happens as viruses mutate and multi-generation variants occur?
The history of virology, what we know, and I talk about virology 101. This is really simple way of just explaining it. The initial virus, the original virus, is the worst. It's the most lethal. It doesn't spread as fast, but it's the most lethal. It kills people. It kills a lot of people. As the variants increase, as you go generation by generation, that's why I talk about multi-generation variants. The contagiousness or the infectiveness becomes very, very fast. You can have whole families infected or whole groups infected pretty much in a day or two. The spread is faster, but the virus is weaker. The symptoms are weaker, are less lethal, less problematic, less symptoms. And in COVID, we've seen that. We've seen the Wuhan virus. We've seen variants from Italy, US, Boston in particular. We've seen Boston, New York, UK, and all land up in India. And we've seen, I actually saw differences in symptoms. And I could say, okay, this is from this place, this is from that place. So those were the first generation of the virus. And a lot of people died because of that. The death rates were like above 5%. When we got the Delta virus, our death rate dropped all the way down to 2%. Okay, I'm talking about 1.82% in the country. So as you start getting variants, multi-generation variants, the death rates will come down, the hospitalization will come down, a lot of things will happen, which is good. I expect something similar for Omicron. I really want to see what South Africa will all do. The next 2 to 4 weeks will be very telling as to what the progression of disease with this variant will be. And if it is, like we've said, a variant from Delta or from any of the earlier ones, I do expect it to be very, very mild and not as deadly as even Delta used to be. So we're looking at death rates of probably less than 1%, maybe even 0.5% or less, less hospitalization rates. And you'll still have symptoms, you'll still have COVID, you'll still have all that, but nothing to really worry. I mean, the advantage of this is that the immunity in the country, in the people of the country, the population gets built up. So for me, I look at it as a positive hobby.
Right. So Dr. Darrell, what sort of treatment would you use?
I had a protocol. I developed a protocol way back in April and May of last year, 2020, which I had used for the original variants, for the original virus, for then the variants of it. And for Delta, I've used the same protocol. The early treatment drug protocol that I developed, I've used the same treatment protocol. I don't think I will need to change it because it approaches the three key factors: anti-inflammatory, antiviral, and anti-clotting. So those are the three legs of the stool or legs of the disease for COVID-19. It's a super inflammation, or I call it the hyperinflammation. It's caused by a virus. So you want to kill the virus. You want to, the drug I use actually decreases the replication or prevents the replication of the virus. And the third thing is, of course, the anti-clotting. You want to prevent clotting. So the three drugs I use, and the rest of it is all about symptoms. You have cough, cold, fever, you give certain drugs. You've got diarrhea and nausea, you give other drugs. So then it's all about symptomatic approach. But the three-legged stool or the three-drug regimen I use, which is anti-inflammation, antiviral, and anti-clotting, will remain the same for COVID. If it's COVID virus, it'll remain the same. Aubrey?
Okay. And what do you think will happen to the Delta variant that has and is still causing havoc around the world?
If Omicron establishes itself, usually what happens when you get a new variant, that variant tends to move faster through the population and it occupies more space. It takes over more territory. And the older variant now has got less people to infect. So when you have less people to infect, eventually it'll be run into extinction. The Delta variant, I expect it to die out. Maybe in 3 months or 6 months, the Delta variant will be dead and gone, and it'll be the Omicron variant, or maybe the one after that. But I look at it as positive that we are having these variants, and we have treatments for it. Now, the funny part of this, the strange part of this variant is that this variant evades the vaccines. So vaccines are not going to help to treat or prevent this variant. Now, some of the companies have announced new vaccines will be developed in 100 days, 120 days to protect against Omicron or Omicron. We'll have to see how that works out. But I think in the natural selection, the Delta variant will be run into extinction, and the Omicron variant will be the one that will supersede everything.
Is that a good thing or a bad thing?
In my view, that's a great thing, because now we are looking at getting an infection in the general population for those who haven't had COVID. Remember that those who've had COVID will be protected against this variant. But those who haven't had COVID, who've had the vaccine, who've not taken the vaccine, whatever their reason may be, whatever their status may be, if they get this, I think the disease significance will be much less. The disease severity will be less. So for them, this won't be a killer, unless, of course, the immune system is very badly damaged or very, very low or something like that. I would still recommend that people follow certain rules, what I call COVID appropriate behavior. That is, using your mask, maintaining social distancing, not getting together big parties. We've gone through our festival season in India very, very well the last 3 months. September, October, November, and hopefully December will be pretty clean. A lot of people expected a third wave, which I did not, because I thought Indians had learned the lesson, and I think we have done.
Well, thank you. Thank you for that hope that you've given us, Dr. Darrell, and thank you for joining us this evening and sharing. Well, I'm relieved, and thank you. We'll have you more. We'll have you share more thoughts in the near future. But before we close, any last thoughts or advice?
This is for everybody, and not only in India, but anywhere in the world. If you are and you think you've got Omicron or you've got stuff, you may have an infection, talk to me or talk to anybody who treats COVID with early treatment protocols. The earlier you come for treatment, the better it is. The more chance you have of getting less disease and stopping the disease progression. So my comments would be, or my suggestion would be, if somebody thinks they have Omicron or they have Delta or whatever, talk to your doctor who treats COVID with early treatment protocols. Don't sit at home and wait till the fire reaches the top floor. No fire department, when you call them and say, I've got a fire in my house, will say, no, wait till it gets to the top floor, then call me. They'll come running. Adopt the same approach in COVID. Treat yourself or get somebody to treat you in time, really early, so then you can put out that fire in your body.
Thank you so much, Dr. Darrell. And friends, we'll have Dr. Darrell address us in a few weeks as we see things turn out. But Dr. Darrell, it looks like we need to continue to be cautious. We need to take care. We need to take COVID appropriate behavior seriously. Am I right?
Yes, absolutely. And you also need to maintain your immunity status. So make sure your vitamin D levels are above 60 nanograms per milliliter and less than 100. That's my pet topic. I always talk about it. Somewhere in the discussion, I bring it up. If your vitamin D is above 60 and there's a paper out which talks about above 50 and your chance of dying of COVID is almost zero. So my thing is anybody above 60 will have a very mild, if not asymptomatic COVID. So guys, ladies and gentlemen, please follow what I say. Thank you so much.
Thank you.
Aubrey.
Thank you, Dr. Darrell. And please stay safe and healthy. Thank you.
Thank you.
Bye-bye.